Hi everyone, Dr. Luke Peterson here with the Knee Replacement Therapist. In this episode we're going to look at a very common and useful exercise called the lateral step downs. Hi everyone, so today we're looking at an exercise called lateral step downs. And this is a really great exercise to look at the overall functioning of your body, your legs, stability in your hips with a functional dynamic type of movement. This can be a really challenging exercise, and when you have problems with it or difficulty, it helps to piece out different things that can be worked on to improve it. So I have this little stool here. If it's your first time trying this exercise, you probably want to try something basically as small as you can get it. If you get those exercise steps, you can usually they're I think about 1-inch increments, so you can really start at a really low level and get the technique, get the basics down before trying to increase and try the exercise with a really high step. So what you're going to do with this exercise is you're going to put one foot on the side of the step like this, and then you're going to stand up like this. Now, the leg that's probably being challenged more is the leg that's on the step. So you probably, if you had to pick one, you would want to put the surgical leg on this side, but obviously I always recommend trying these exercises on both sides to kind of equal things out and get the benefit for both sides of the body. So what you want to do is you're going to basically just come down in a very slow, controlled manner, and you're going to tap your heel on the ground. I'm not going to go all the way to the ground today just because it's such a far way with this step, but you're going to tap the heel and then come back up. And I like to have people put their hands on their hips just to give you a cue. And what you'll notice with this exercise is you really have to have a couple different things. A lot of people, they'll try this and they might just lose their balance and they'll fall off the step. Some people, they'll try this exercise and they'll notice this will happen, so their knee will start to cave in, or knee medialization, which we obviously want to stay away from. And there's other things that you might see as well. You might see the hip start to drop like this, different compensations. And so what you really want to try to do with this exercise is really focus on technique. So you want to do a nice good hip hinge, keeping the back in a relatively neutral posture. You want to keep that knee coming right over the foot. Don't let it cave in or even cave out either. You want it to come kind of right over the foot. And you want to keep good level hips and pelvis. Don't let the pelvis tilt up and down. So kind of a good way, I'll do my best effort here. Down, touch to the ground with your heel, and then come back up nice and controlled. And you can do sets of 10 or whatever you want to try. And what happens is, if you're having some difficulty, so for example your balance is off, you're going to have a tough time. If you have weakness in your hips and instability in your hip muscles and your pelvis, you're going to have a tough time. If you have poor mobility in your ankle, you're going to have a tough time. All of these things are really important and needed to do this exercise with good technique and in a good controlled manner. So really, it's a really good dynamic movement, dynamic exercise. It takes practice, and if you still have difficulty with it, you want to look and try to kind of tease out why you're having such difficulty. Do I have to strengthen my hip muscles? Do I have to improve the motion in my ankle? Do I just have to work on having good straight alignment with my knee and be comfortable putting that weight through my knee? Do I have to work on my balance and stability on that leg? Whatever it may be. It's a really good kind of test to see where you are with a really functional, dynamic type of movement that requires a lot of control to do correctly. Again, I would recommend, that's why I would recommend, starting up here and going through this motion. That's a pretty far motion and can be very challenging. especially if you still have some stiffness and discomfort in that knee. So again, start with a very low step, as low as you can find, and then work your way up from there. This is the lateral step-ups, a great functional dynamic exercise. Really looks at your ability and function with different parts of the leg and the body, and a good challenge as well. Thank you very much for watching, everyone. This has been the Need to Know Show, and have a great rest of your day.